Hello and welcome back to another video. So I think I spoke in a previous video about how I requested my scan results because I don't like being given the results in my consultant's appointment. My breast cancer nurse came back to me and she said she's spoken to the doctors, and because of the anxiety it causes me, they were going to release the report. And then she put at the end, good news. So I'm going to run through my report. There is a couple of things I'm a little bit concerned about, so let's just go. I'll tell you what it says. The first thing, neck has not been imaged. That is a concern for me because I have cancer along my clavicle bone, but also in the neck here. So there is no mention in this report of anything to do with my neck or these lymph nodes here. So I don't know what's going on there. I know I've been getting more pain down here, and I can definitely feel a lymph node here, which is concerning me. So I will be bringing that up with my consultant when I speak to them. Right chest. The known in situ left breast malignancy measures 16 by 15 millimeters, similar to previous, however slight decrease in the degree of enhancement. Now I'm really surprised at that because I can feel that, and it's definitely a lot flatter. Maybe the circumference is the same, but I would have thought there would have been, I would have expected that to be like 10 by 10 millimeters, not staying the same. So I was a little bit surprised by that. The pathological node within the left axilla has mildly increased in short axis diameter of 80 millimeters, previously 60 millimeters. Maximum cortical thickness is approximately the same. Now I'm not surprised about that because I actually said to Dustin the other week, I could feel my lymph node in my armpit. I've never been able to feel it before. So I'm not surprised. So that's a little bit, why is that growing? I know maybe measurements, I mean sometimes can they be a bit out with slight measurements. Anyway, let's continue. Other axillary lymph nodes are within normal limits by size criteria, so that's really good news. So the previous seen necrotic pathological nodes within the mediastinum has significantly reduced in size. The superior paraarachnotic node previously measured 21 by 28 millimeters. This has reduced to 13 by 9 millimeters. The pretracheal lymph node previously measured 25 by 24 millimeters and it is currently measuring 8 by 11 millimeters. I was so pleased when I saw that because I'm so worried about my chest lymph nodes because they can affect my breathing and put so much, you know, if they grow, put so much pressure that eventually I would just die. I wouldn't be able to breathe. So the fact that they are almost at normal levels now, normal heart size, no century pulmonary embolus. Now this is the bit as well that I've got to ask them about. There is consolidation at the base of the right middle lobe and right lower lobe. No definite lesion. So basically in that lobe, those tiny air sacs should be filled with air. Mine obviously are filled with probably fluid, and I would say fluid, and that would be generally caused by things like pneumonia, aspiration. The fact that I had pneumonia back in March and they were suspecting I might have bronchitis now, that is something that they're going to have to do. But I've been saying for months now, since I had pneumonia back in March, that I've been struggling to breathe. When I like go upstairs or go up a hill, I have to stop. And also I'm coughing on fluids. Like it quite often goes down the wrong way and I end up coughing. So I need to discuss because we need to get to the bottom of that. And that brings me to my complaints with the hospital. I bring up stuff and they don't do any further exploration of what's going on. They're just like, well, my last scan, nothing showed up. But I'm reporting symptoms, you should be exploring. Anyway, no pulmonary mass, so it looks like all my lung nodules aren't visible. I'm deducting from that. My liver is a little bit on the fatty side, but only mildly. I need to change my diet. no liver lesions, normal gallbladder, pancreas, spleen, adrenal glands and both kidneys, pelvic organs are normal, the bowels normal, pelvic free, blah blah blah. The known bone metastases at the T11 and L2 have become more sclerotic, which may be a result of fracture healing, so they're starting to harden. So the fracture healing plus or minus treatment response, no new bony lesions. So conclusion, mild change in the left breast and left axilla, but overall suggestion of stable. Sorry. It's just really good news. Stable disease at these sites, good partial treatment response with the mediastinal nodes, now almost normal, right middle lobe consolidation, and then they put there any signs of infection, so they must be saying are there any signs of infection because they put a question mark. T11 and L2 mets have become more sclerotic, which may be the result of fracture healing plus or minus treatment response, and that is my report. So I'm really pleased. Can't wait to get back on treatment because I've been off because of the diarrhea and cramping. They're probably going to reduce. I kind of don't mind reducing a bit because I really want to push with the repurposed drugs and diet and mindset and faith and everything. Faith and healing. So those are my results. So it's good news. Anyway, but I'm all too aware that the next scan might not be good results because I tend to have one good result when I start treatment. I always have one. I have my scan, I usually get a shrinkage and then it starts growing again. So, but anyway, that was my scan results, so I just thought I'd inform you.